All right. So this one's going to be shorter, probably a lot shorter. However, I still didn't want to rush through that last one just in case. So, impulse control disorders. Oppositional defiant disorder is our first one, and this is primarily a childhood disorder. The child is angry and has an irritable mood. They can be defiant and have vindictive behavior. The book was saying that the vindictive acts are disturbingly regular for at least 6 months for part of this to be diagnosed. That they're very spiteful and have malicious behavior towards people. They do not want to do things that people tell them, so they're very defiant, and they get mad very easily and lose their temper. So the experience with this disorder, you're going to see social difficulties. They're going to have difficulty making friends, attending school, functioning as a member of the family unit, conflicts with authority figures, so parents, teachers, academic problems, not wanting to attend a school or to do assignments. And this is often a predictor to emotional disorders in young adulthood. Okay, so intermittent explosive disorder is a pattern of behavioral outburst in adults 18 years and older, characterized by an inability to control aggressive impulses. It leads to problems with interpersonal relationships, occupational difficulties, and criminal difficulties. A person may have a hard time holding back aggression and the reaction to situations. So your book said, for instance, a person punching their fist through a pane of glass after not being able to locate a video game may destroy room, break furniture, or damage costly property. The behavior needs to show a repetitive pattern and interference with normal function, such as them being able to stay employed. And that's part of another way that this is diagnosed. Okay, so the pattern goes from being upset to being remorseful. So the first stage is tension and arousal. Second stage is the explosive behavior. Third stage is the sense of relief. And the final stage is feelings of remorse, regret, and embarrassment. So what your book talked about was, and that's why there's a car with the guy waving going by, is the guy who experienced like a little bit of road rage. So he gets frustrated and mad because the guy ahead of him is going really slow. And then the second stage is the speeding super fast, squealing the tires to go around him and cut him off real fast in front and maybe waving his hands around. The third stage is that whole sense of relief, like that's right, you were going too slow and I got around you, and now I feel much better. And then the final stage is the feelings of remorse, regret, and embarrassment, in which the guy says, wow, I just risked my life to pass an 80-year-old man to get to a party that will go on for hours. I need to stop doing this. All right, so conduct disorder is the behavior is usually abnormally aggressive, is a persistent pattern of behavior in which the rights of others are violated and societal norms or rules are disregarded. This may lead to destruction of property or physical injury of others. Also coercion into activity against the will of others, and the book did say that includes sexual activity, and that these behaviors are going on and continue for a period of 6 months or beyond. People with conduct disorder crave excitement and do not worry as much about the consequences as other people would. Complications are academic failure, school suspensions and dropouts, juvenile delinquency, drug and alcohol abuse, and juvenile court involvement. There's both child onset and adolescent onset, both of which can occur in a mild, moderate, or severe form. So your childhood onset conduct disorder occurs prior to the age of 10 and is found primarily in males. They see that there is little concern for others and lack of remorse or guilt over things that happened to others that were caused by them. They project a very strong image, but have a low self-esteem. And as I was reading this, I was thinking, wow, that sounds a lot like our antisocial personality disorder. And sure enough, that's what it says in the book, that without intensive treatment, that may later develop into antisocial personality disorder. So your adolescent onset conduct disorder, there are no symptoms present prior to the age of 10, and that the male to female ratio is not as high. So it's not more prevalent in men or males versus females when it is the adolescent onset, which the book said that indicated that more girls become aggressive at this developmental stage. Callousness is the lack of empathy, lack of guilt, and that may be a predictor for the antisocial personality disorder as well later on in adults. So conduct disorder continued. Pyromania, that's the repeated deliberate fire setting. So the person that is the pyromaniac experiences tension or excitement prior to setting the fire. They will show an unusual interest in fire, such as wanting to play with matches. Experiences pleasure or relief when setting the fire, and it's done solely to satisfy that relief pleasure. And so the book said they're not doing it to cover up a crime or anything. It's just for the satisfaction of setting the fire, and it feels good for them. And then there's kleptomania. This is the repeated failure to resist urges to steal objects not needed for personal use. Or for monetary value. So the book said the example was a person may take books even though they cannot read, or baby outfits they consider cute even if they have no children, or if they have plenty of money to buy them. So the person experiences a buildup of tension before taking the object, and that's followed by the relief or pleasure following the theft. So the book also said, though, and this was interesting, that it's possibly linked to addiction disorders since the person is acting to satisfy a compulsion. So application of the nursing process for all of these psychobiological disorders that we're talking about, or impulse control disorders. We're always assessing for suicide because we know these patients have a lot lower self-esteem. Our own self-assessment about this is providing equal care to all. So as all three of these different lectures have shown, that we've always got to be keeping our own selves in check when it comes to these different kinds of disorders that we feel like, you're doing it to yourself. So we got to be really careful with doing that. Diagnosis and outcomes identification, again, same kind of table as the last couple ones that I sent you guys to. This is on page 406 for table 21.2, and then table 21.3. I don't know why that's in there like that, because actually both of them are 21.2. So I apologize for that. That should not say 3, that should say 2. Those are both in that same table on 406. Some more nursing process, implementation or psychosocial interventions. We want to establish a rapport with this patient, promote safety, set limits, boundaries, provide activities for them, because we want them to start working towards better coping and get them towards the path of health, or mental health, versus these disorders that they have. Pharmacological interventions. You guys know that sometimes I get tongue-tied. Anti-anxiety, antipsychotics for intermittent explosive and conduct disorders. The book did say, and I'm looking for it really quickly if I can find it, that there was not any medications that we use for, my gosh, I really can't find it. Oh, for the oppositional defiant disorder. But the other two, we can use some other things like, the serotonin reuptakes like Prozac, and other things like Clozaril and Haldol for the conduct disorders and that, to just try to help with that. But there's still not like treatments for that. It's helping with some of the symptoms you know, like the hyperactivity or the aggravated conditions that just kind of help relax and calm these patients. So health teaching and health promotion, we want to assist families with creating safe environment, discuss realistic behavioral goals with them. All right, that's it. I managed to spread that out into 10 minutes. So I'm going to post these. Obviously, that's why you'll have seen them. And then I'm going to put the discussion board up probably tomorrow morning. So this is Monday night right now. It'll be Tuesday morning. I will try to get that up there. So after you view these 3, you can then go ahead and do the assignment. So that is all. Thank you again. Let me know how you like this. We're not going to do it again, but I just wonder how you like it. Thank you. Bye.